My name is Go Sing Yi from EP2 Group 2, and I'm here to talk about the pro of the euthanasia. For the first, we know that we use euthanasia at the last resort when all other options are off the table. The average person of doctor is not going to support the proactive terminations of a life when there's no suffering involved. Euthanasia is different than suicide, even through both action and a life, because the former uses assistance and the latter does not. The goal with this help is to end the suffering of lengthy death, especially if there is a chronic and severe pain in this process. People often criticize the pet owner for not taking them to the vet to end their suffering when something tragic occurs, even if it's only cancer or old age. When it comes to an individual that wants to take the same actions and they receive criticism for it, and if like in this situation will give others things like maybe the pet life is not very valuable than a individual. So, and I don't think this can make sense. So the second, the patient can avoid the issue caregiver guide with the euthanasia, because one of the most significant challenge that occur with a terminal diagnosis is emotion of guilt and shame that patient has with regards to their caregiver. They begin to like a burden on people they love, creating the reaction that cause relationship challenge, because this is only nature to push people away to help them avoid pain. Legalizing euthanasia might not be popular options in some circles because this can create organizations for the transitory time that everyone experience in the situation such as this one. And by helping someone to find the physical peace they need, there can be a process emotional healing that can help everyone push through their grief and greater consistency. So for the next pro, we use specified legal requirement to eliminate the treat. Sorry, I will repeat again. And we use a specific legal requirement to eliminate the threat of a mistaken identity. There's two primary concerns that the critics of euthanasia often express: helping an individual die without their permission or targeting incorrect patient for this process. And in US, which have a Death with Dignity Act required that patients self-administer their liver prescriptions. You must also be of sound mind when making these decisions, and the law requirement that you make it more than once or waiting a period. If someone in an altered state or patient with a mental disability issue a written request of euthanasia, it would be reject or lack of competency. So some jurisdictions require the presence of the two witnesses as well, and they cannot be a relative or someone who would benefit from the estate inheritance. Okay. So the following are eliminating fear of financial burden. A survey in the US state of Oregon where assisted dying is illegal, showed that 66% of euthanasia requests involved the patient who did not want to be financial burden. Inadequate funding for palliative care and pain management, and government relies on nursing home or contribute to the despair felt by many who reach old age, endure frustrating physical limitations, or are afflicted with the debilitating condition. However, it adds, euthanasia opponents argue the provision of the adequate pain management and palliative care could improve the quality of life and eliminate the demand of anesthesia. And for the last, death is still going to happen on way or other. It is the way that a person dies really important for the rest of the society. The advantage and disadvantage of euthanasia should be rightful debated, but it is not our place to dictate an outside sense of morality or ethic on a person who is trying to manage a terminal diagnosis. Those people are already working towards an end of life scenario. If they decide not to take advantage of the legal process, there's an excellent chance that they will pass away in the near future anyway. So that's all for me. Thank you.